Hello and welcome to SRG's Medicine. Today, in this video of Respiratory Medicine Series, we shall be talking about hemoptysis. So, the contents of this video are pseudohemoptysis, physical examination, which we'll be dividing on different topics. So, the first one being the parts of physical examination, and the second one being detailed study of physical examination in hemoptysis patient. And we'll be talking ultimately about diagnostic test and summarizing the video at last. So let's move on. So what is pseudohemoptysis? So as the name suggests, it is not a true hemoptysis, but rather it is a condition in which the sputum appears red or brownish, but there's absence of blood in it. So it appears to have blood, but it is actually lacking the blood. So it occurs in conditions such as Serratia marcescens pneumonia with its red pigmentation. It occurs in glass sanders due to accumulation of iron oxide, and it occurs in cases of ruptured hepatic amoebic liver abscess with the appearance of typical anchovy sauce sputum. So what do I mean by anchovy sauce sputum? Let's see in the picture. So here it is a picture of aspiration of hepatic liver abscess. So in which this fluid is what we call as anchovy sauce sputum because it resembles anchovy sauce. And normally, if a patient has ruptured hepatic amoebic liver abscess, then the sputum comes out of this color. So that is why it's anchovy sauce sputum. The next thing is that we'll be talking about physical examination. So what are the parts of physical examination? Firstly, we look at the patient carefully, and that is what we know as inspection. And the next thing, we touch the patient. So that touching of the patient is known as palpation for diagnosing studies. And the next thing, we make sound on the patient's body. So those sounds which we make, or that process is known as percussion. And after that, we use our stethoscope for finding out different sounds on the patient's body. That is known as auscultation. So those were the 4 parts of physical examination. So now moving on to the detailed study of physical examination performed in a patient with hemoptysis. Firstly, we measure vitals. So the first and most important part of the physical examination in case of hemoptysis is vitals, because let's just remember that hemoptysis might be presenting in an emergency setting. So vital is most important in these conditions. So it includes pulse, blood pressure, respiratory rate, and temperature. And the signs of hypovolemia and respiratory distress must not be missed. And if they are present, then we must proceed to the stabilization of vitals before doing any other investigation. So what are the signs of hypovolemia? It includes cold, clammy extremities, increased pulse rate, increased capillary refill time, signs of hypertension, orthostatic hypertension, poor skin turgor, dry mucous membrane, weak peripheral pulses, and other signs as well. And the signs of respiratory distress can be clearly visualized in this coming picture. So here you can see the patient has flared nostrils, pursed lip breathing, though this pursed lip breathing is common in obstructive lung diseases, but is also quite common in any other kinds of respiratory distress. And here there's a prominent sternocleidomastoid muscle, increased prominence of clavicle, sternal indrawing, increased work of abdominal muscle for respiration, and the typical tripod stand, because here, as the tripod has 3 bases, the patient also sits in a condition, it's in a state which forms 3 bases. The first one being the buttocks, and other 2 being the legs. So this is a typical tripod position. So let us summarize it. The patient might have flaring nostril, pursed lip breathing, increased prominence of sternocleidomastoid muscle, prominent clavicle, sternal indrawing, increased work of abdominal muscle for respiration, and typical tripod stand position. So these are the signs of respiratory distress in a patient. So they must not be missed and must be managed before moving on to any other cases. So talking about the detailed study of physical examination. So continuing it after vital. So the second thing we do is inspection. So in inspection, we look for the signs of, we look for the respiratory system as firstly breathing pattern, rate of breathing, sign of forced respiration, as we had already talked about earlier, and then we talk about external injuries, whether there's presence of surgical scars, whether there's, what is the chest symmetry, whether it's symmetrical on both sides or seems to be less on one side, which suggests a collapse of lung on that side. So we have to look on these things. But let me remind you one thing, that whenever you look at the patient directly, then the patient might get anxious and might cause increase in the breathing pattern or breathing rate. So that's why we need to find these things. So that is breathing pattern, rate, and signs of forced respiration without looking directly at the patient. So that is when you're taking history about the patient or doing any other physical examination part, then you just look at these things, because otherwise you will make the patient nervous and you might alter these things. And the next thing we'll look for is nose and throat inspection, which helps us to rule out the bleeding from nasal cavity, mouth, or that is oral cavity or pharynx. And the next thing would be, we'll look for the jugular pulsation, which is increased in the cases of heart failure. And then the next thing, in systemic one, we look for pallor, icterus, cyanosis, clubbing, edema, petechial rashes, and xanthelasma. Continuing on palpation, we look for chest expansion. We see for the tracheal deviation if there's presence of any. And we look for tractile vocal fremitus, because tractile vocal fremitus helps us to determine whether there's presence of pleural effusion, or whether there's presence of consolidation of lung, or whether the lung parenchyma is normal. And the next thing is that we look for the cardiovascular system, carotid pulse, and jugular venous pressure. So as I've already mentioned earlier, jugular venous pressure is increased in the cases of heart failure. And in systemic setting, we look for edema and find out whether it's pitting or non-pitting edema. And we look for lymphadenopathies, specifically in the axillary and cervical regions. So the next thing we do is percussion. So in percussion, we do it on chest and axilla. Normally, the percussion on chest and axilla would give us a resonant sound. However, in the cases of collapse, as seen in lung atelectasis, or consolidation as seen in pneumonia, the sound becomes dull. So in cases of pleural effusion, it becomes stony or very, very dull and sounds as if we are hitting one stone by another stone. So that is stony sound on percussion. And the next thing is that in cases of pneumothorax, it appears hyper-resonant. So these are the things that you'll find out by simply percussion on the chest. But note the location of the lungs and heart, because heart seems to have dull sound, whereas lungs have resonant sound. So you need to know the surface anatomy of it first before doing the percussion. We'll be talking about it in detail in the coming videos on physical examination of the respiratory system, but for now, let us keep it till here. The next thing we talk about is auscultation. In auscultation, we hear for the respiratory sounds, we hear for wheezing, stridor, or in crackles, and we also hear for heart sound to rule out any other cardiac causes. So after this, after doing all of these parts of the physical examination, if we suspect for any cause or any disease causing hemoptysis, then we move on to the examination based on that disease. So whatever the findings are positive in that disease, we perform those examination only after this. So that is just like repeating or reviewing our diagnosis. After that, so let's move on to the second part of our video, that is diagnostic tests. So here I'll be listing few of the important and commonly used diagnostic tests, though they are not exhaustive or they are not the only tests to be performed in cases of patients with hemoptysis. So these include chest X-ray, complete blood count, electrocardiogram, coagulation studies, urine analysis, CT scan, bronchoscopy, and electrolyte, pulse oximetry, and arterial blood gas panel. So let's move on with complete blood count. So if you perform a complete blood count and get the result of complete blood count and find out that the patient has anemia, so in such cases, you suspect that the patient might have some chronic condition which is causing hemoptysis, or hemoptysis itself might be chronic. So that means it must be a recurrent problem. And the next thing is that in the cases of polycythemia, that is increased RBC count, so you suspect of neoplastic condition, that also myeloid neoplasms. Myeloid neoplasms. And if you see that the platelet count is decreasing, that is in thrombocytopenia, you suspect hemophilic condition. Whereas if you see that there is increase in the platelet count, that is thrombocytosis, then you have the suspect of myeloproliferative conditions. And in cases of decreased WBC count, that is leukopenia, you suspect for the primary or metastatic marrow tumors. Whereas for the cases of leukocytosis, that is increased WBC count, you suspect for infection or neoplastic condition, that is mostly lymphoid neoplasms. And here, let us note that the infection is quite important because complete blood count will help us rule out infection, because in infection, most commonly we see leukocytosis. And after finding out that there is leukocytosis and we suspect for infection, we move on with differential leukocyte count, which helps us to further classify and rule out which are the possible causes of infection. After that, so chest x-ray, as we have already mentioned that in cases of hemoptysis, chest x-ray is a must. So why is it? Because it helps us to rule out the pulmonary and bronchial condition causing hemoptysis. And the next thing is that for ruling out cardiac causes, we need electrocardiogram. And coagulation studies will help us rule out hemophilic condition. So urinalysis will help us to rule out certain diseases such as good pastry disease, vasculitis, or other autoimmune conditions. So we do CT scan for two things. The first one being confirmation of our X-ray results, and the next thing being the localization of source of hemoptysis. But for localizing the source of hemoptysis, we use contrast CT angiography. And finally, we talk about bronchoscopy. So bronchoscopy is quite important in any of the pulmonary conditions because bronchoscopy can be used for both diagnostic as well as therapeutic uses. So we also talked about electrolyte, pulse oximetry, and arterial blood gas panel, and these are used in emergency management. So if a patient presents to you with a massive hemoptysis, then we do electrolyte, pulse oximetry, and arterial blood gas panel simultaneously while maintaining our vitals. Then in such condition, they can be used for continuous monitoring whether the patient is getting good or worse. So we have to maintain vitals, and for continuous monitoring, we use these tests. Let's summarize the first part of our video. So pseudohemoptysis is a condition in which the sputum appears red, but not due to blood. For example, Serratia marcescens, pneumonia, sandblasters, or ruptured hepatic liver abscess. Next thing is physical examination includes inspection, palpation, percussion, and auscultation. And the final thing is that vitals must be checked whenever a patient comes with massive hemoptysis. And if the signs of hypovolemia or respiratory distress is present, then the vitals must be stabilized before proceeding to any other diagnostic tests or history taking part. So this is a must. So summarizing our final part of the video, that is about the diagnostic test. This, as you can remember, I have mentioned about this picture in the first video of hemoptysis, that is on the causes of hemoptysis. So here you can see different headings on the causes of hemoptysis. It might be bronchial, parenchymal, vascular, cardiac, or hematologic. So what are the appropriate tests to be performed in these conditions? So if we suspect for bronchial and parenchymal diseases, then it is most appropriate to perform chest x-ray and bronchoscopy. But if we suspect a vascular disease, then we need to perform urine analysis, contrast CT, angiography. In cases of cardiac diseases, electrocardiogram itself is sufficient. However, it is wiser to perform chest x-ray also. And the next thing is that in hematologic diseases, we need to perform coagulation studies, complete blood count, and sometimes differential leukocyte count as well. So this is the summary of diagnostic tests we perform. And let me tell you that this is not an exclusive list, and we can perform a vast number of diagnostic tests, but we need to be careful to choose our diagnostic test, because choosing the best diagnostic test for a given patient, so for a given individual patient, would be saving our time as well as money. And in medicine, always, specifically in emergency medicine, time means life of the patient. So thank you. Hope you enjoyed it. Stay safe. And please do comment on any of your feedbacks on the video or any questions. Hope you enjoyed it.